Welcome back to Dr. Welling Insights, where we help you understand the critical medical information that directly affects your health, longevity, and quality of life. I'm Dr. Welling, and today we're discussing something that affects millions of seniors worldwide, a dangerous and widespread misunderstanding about blood pressure readings that could be seriously putting your health and safety at risk. Most people know that blood pressure is important to monitor, and they understand that high blood pressure is not good for their health. But many people, particularly seniors, don't fully understand what their blood pressure numbers actually mean or how to interpret them correctly in the context of their own age and health situation. There's a widespread belief among seniors about what constitutes a healthy blood pressure that's actually outdated and incorrect. This belief is causing many people to either overtreat their blood pressure with unnecessary medications and side effects, or undertreat their blood pressure and miss opportunities to prevent heart attacks and strokes. The dangerous mistake involves not understanding the difference between systolic and diastolic pressure, not understanding what those numbers mean for your specific age and health situation, not recognizing that blood pressure targets have changed significantly in recent years based on new research, and clinging to outdated standards that are no longer appropriate. By the end of this comprehensive video, you'll understand what your blood pressure numbers actually mean, what the correct target should be for your age and individual health situation, why the old standard of 120/80 is no longer appropriate for everyone and has been superseded by better understanding, and what you should actually be doing to manage your blood pressure correctly and safely. This knowledge could prevent a heart attack, stroke, or other serious cardiovascular event that could change your life or end it. If you're over 60 or if you care about someone who is, this information is absolutely critical for maintaining health and preventing disease. Please watch all the way through to the very end. And if this information helps you understand your health better and clarifies misconceptions, subscribe to Dr. Welling Insights so you don't miss future videos about managing chronic diseases and maintaining cardiovascular health as you age. Before we discuss the specific numbers and what they mean, let me explain what blood pressure actually is and why it matters so much for your health and longevity. Blood pressure is the force that your blood exerts on the walls of your arteries as your heart pumps blood throughout your body continuously. Your heart works as a sophisticated pump, contracting and relaxing in a coordinated rhythm. When your heart contracts, it pushes blood out into your arteries with force. When your heart relaxes, blood pressure decreases. Blood pressure is always measured with two numbers, and understanding what these numbers represent is fundamental. The first number, which is always larger, is called systolic pressure. This is the maximum pressure in your arteries when your heart contracts and actively pumps blood out into circulation. The second number is called diastolic pressure. This is the minimum pressure in your arteries when your heart relaxes and fills with blood before the next contraction. Blood pressure is written as systolic over diastolic. So 120/80 means a systolic pressure of 120 and a diastolic pressure of 80 millimeters of mercury, often abbreviated as millimeters of mercury. Your blood pressure is not static. It naturally varies throughout the day based on many factors. Your blood pressure is typically lower when you're resting or sleeping, as your body's demand for oxygen is lower. Your blood pressure increases during exercise, mental stress, emotional responses, or when you're active, as your body's demand for oxygen and nutrients increases. Your blood pressure might be different at different times of day. Your blood pressure can be elevated by caffeine, nicotine, sodium intake, pain, anxiety, and other factors. This is why doctors usually recommend taking multiple blood pressure readings at different times on different days to get an accurate picture of your typical blood pressure rather than relying on a single reading. A single high reading doesn't necessarily mean you have hypertension, just like a single normal reading doesn't mean your blood pressure is always normal. Now, let me explain the dangerous mistake that millions of seniors are making about their blood pressure targets. For decades, the standard medical recommendation was that everyone should aim for a blood pressure of 120/80 millimeters of mercury, often written as 120/80 or 120/80. This became so ingrained in public health messaging that it appeared in countless health articles, doctors' offices, and health websites. This became so universal that many seniors believe this is the target they should achieve, regardless of their age or their health situation. However, this is not accurate, and blindly following this standard for all seniors can actually be harmful rather than beneficial. The truth is significantly more nuanced and individualized than a single one-size-fits-all number. Blood pressure targets should be individualized based on your age, your existing health conditions, your cardiovascular risk factors, your tolerance of medications and side effects, and other personal factors. The dangerous mistake many seniors make is either trying desperately to achieve 120/80 when they shouldn't be targeting such a low number, or feeling that they've failed or that something is wrong when their blood pressure is slightly above 120/80 when their actual appropriate target might be higher. This creates unnecessary anxiety and can lead to inappropriate treatment. Let me explain the important research that changed our understanding of blood pressure targets. In 2015, a major groundbreaking research study called the SPRINT trial was completed and published. SPRINT stands for Systolic Blood Pressure Intervention Trial. This was a large, well-designed study that included over 9,000 participants, many of whom were older adults with cardiovascular risk factors. The study compared two groups. One group aimed for a systolic blood pressure below 120, representing aggressive blood pressure lowering, and another group aimed for the traditional target of below 140. The study found that the group that achieved lower blood pressure, below 120 systolic, had fewer heart attacks, strokes, and deaths from cardiovascular causes compared to the group targeting 140. These results led to new recommendations from the American Heart Association, the American College of Cardiology, and other major medical organizations. The new recommendations state that systolic blood pressure should be below 130 for most adults, not 120. This is still lower than the old 140 target, but it's not as aggressive as 120. However, and this is absolutely critical to understand, this doesn't mean everyone needs aggressive blood pressure lowering. The SPRINT trial included mostly middle-aged and older adults with cardiovascular risk factors. The results might not apply equally to everyone, particularly to very elderly people or to those without significant cardiovascular risk. The dangerous mistake many seniors make is not understanding that the old 120/80 target was actually quite aggressive for many people. Trying to achieve this aggressively in older adults can sometimes cause harm rather than benefit. When blood pressure is lowered too aggressively, some older adults develop low blood pressure, called hypotension. Low blood pressure can cause dizziness, lightheadedness, falls, fainting, confusion, and reduced blood flow to the brain and other vital organs. Falls in older adults can result in serious injuries like hip fractures, which are life-altering and can lead to loss of independence, disability, and even death. Additionally, aggressive blood pressure lowering requires additional medications. Medications have side effects. Some blood pressure medications cause fatigue, sexual dysfunction, depression, muscle weakness, or other side effects that reduce quality of life. The balance between the benefits of lower blood pressure, which include reduced cardiovascular disease risk, and the risks of side effects and overtreatment is different for each person. What's optimal for one person might be harmful for another. So what should your blood pressure actually be? What is the appropriate target for you? The current recommendations from major medical organizations are that systolic blood pressure should generally be below 130 for most adults, including most older adults who have cardiovascular risk factors or existing cardiovascular disease. However, and this is important, this is not a universal target that applies to everyone. For some people, a target might be 140 or even 150. For others, particularly younger people or those at very high cardiovascular risk, a target below 120 might be appropriate. Your individual blood pressure target should be determined by you and your doctor together, taking into account multiple factors: your age, your existing health conditions, your cardiovascular risk factors, the medications you're taking, your ability to tolerate medications and their side effects, your values and preferences, and your quality of life. Some people feel much better with a slightly higher blood pressure and fewer medications, experiencing better quality of life overall. Other people are willing to take more medications or tolerate more side effects to achieve lower blood pressure. Both approaches can be reasonable and appropriate, depending on your individual situation. The first major change in understanding blood pressure is recognizing that diastolic blood pressure is not as important as systolic pressure for most older adults. In younger people, both systolic and diastolic pressure are important for predicting cardiovascular risk. But in older adults, particularly those over 60, systolic pressure is the number that matters most for predicting cardiovascular risk and outcomes. Many seniors focus too much on the diastolic number and not enough on the systolic number. If your systolic is 135 and your diastolic is 70, that's actually more concerning and requires more attention than a systolic of 120 and a diastolic of 90. The systolic number should be your primary focus as an older adult. The second major mistake seniors make is not understanding that blood pressure naturally increases with age. This is a normal part of aging. Your arteries become stiffer and less elastic with age, and this increased stiffness increases blood pressure. This doesn't necessarily mean something is pathologically wrong. This doesn't automatically mean you need aggressive treatment. Some blood pressure increase with age is expected, normal, and universal. The question is not whether your blood pressure has increased with age, but whether your blood pressure is at a level where treatment is beneficial for you based on your individual risk profile. The third major mistake is not taking blood pressure readings correctly. The way you measure your blood pressure significantly affects the accuracy of the reading. Many people get inaccurate, unreliable readings because they're not measuring correctly, and these inaccurate readings lead to inappropriate treatment decisions. To get an accurate reading, you should sit quietly and calmly for at least 5 minutes before taking your blood pressure, allowing your body to settle into a baseline state. Your feet should be flat on the floor, not dangling or crossed. Your arms should be supported at about the level of your heart at mid-chest height. Your back should be supported by the chair. You should not have a full bladder, as a full bladder can artificially raise your blood pressure. You should not have consumed caffeine or nicotine in the past 30 minutes. You should not have exercised in the past 30 minutes. You should use the same arm for measurements, as blood pressure can differ slightly between arms, sometimes by 10 to 15 millimeters. You should use a properly calibrated blood pressure monitor. Automatic home blood pressure monitors are generally more accurate than manual ones. If you're getting readings at a pharmacy or doctor's office, make sure they're using proper measurement technique. Many pharmacy blood pressure machines are not calibrated properly or not used correctly. For accurate monitoring, a validated home blood pressure monitor is usually better than occasional readings at pharmacies. You should take multiple readings, at least 2 readings per measurement occasion, and average them. You should take readings at the same time of day when possible. You should keep a log of your readings to show your doctor. The fourth major mistake is not understanding the difference between stage 1 hypertension and stage 2 hypertension. These stages indicate severity and guide treatment approaches. Stage 1 hypertension is defined as systolic 130 to 139 or diastolic 80 to 89. Stage 2, hypertension is defined as systolic 140 or higher or diastolic 90 or higher. The treatment approach differs significantly between these stages. For stage 1 hypertension, lifestyle modifications like weight loss, regular exercise, reduced sodium intake, reduced alcohol consumption, and stress management are often the first step before starting medications. Medications might or might not be needed depending on your cardiovascular risk and other factors. For stage 2 hypertension, medications are usually indicated in addition to lifestyle modifications. However, even this should be individualized based on your situation. The fifth major mistake is not understanding that high blood pressure often has no symptoms. Many people incorrectly think if they feel fine, their blood pressure is fine. But high blood pressure is often called the silent killer because it causes no symptoms, yet damages your arteries and heart silently over time. You might feel completely fine and still have high blood pressure that's actively damaging your cardiovascular system. You might have no headaches, no dizziness, no chest discomfort, and still have elevated blood pressure. This is why regular blood pressure monitoring is important. You can't rely on how you feel to know if your blood pressure is controlled. The sixth major mistake is not taking blood pressure medications as prescribed and as directed. Some people stop taking their medications because they feel fine or because they want to see if their blood pressure has improved on its own. But blood pressure medications need to be taken consistently to work effectively. If you stop taking them, your blood pressure will go back up. Some people reduce their doses without talking to their doctor to save money or reduce side effects. Some people skip doses occasionally. These approaches undermine blood pressure control and increase your risk of heart attack or stroke significantly. If you're having side effects from medications, or if medications are unaffordable, talk to your doctor. There are usually options available like different medications with different side effect profiles, lower doses, or alternative approaches that can help. The seventh major mistake is not realizing that blood pressure control is important, but not the only thing that matters for cardiovascular health. Some people become obsessed with achieving a specific blood pressure number and ignore other important health factors. Your overall cardiovascular health depends on multiple factors: blood pressure, cholesterol levels, blood sugar control, weight, physical activity, diet quality, smoking status, stress management, and sleep quality. Working on all of these factors together is more important than focusing on blood pressure alone. A person with a blood pressure of 130 who exercises regularly, eats a healthy diet, maintains a healthy weight, and manages stress might be healthier overall than a person with a blood pressure of 115 who is sedentary, overweight, eats poorly, and is stressed. The eighth major mistake is not understanding the relationship between blood pressure and medications. Some people are surprised when their blood pressure is still not controlled despite taking medications. But blood pressure is complex, and multiple factors affect it. Sometimes you need multiple medications working together to control blood pressure. Sometimes a medication that worked well for years gradually becomes less effective, and adjustments are needed. Sometimes certain medications interact with other medications or with foods, affecting their effectiveness. Your doctor might need to adjust your medications periodically to maintain good control. This is normal and expected. The ninth major mistake is not realizing that home blood pressure monitoring is often more accurate than office readings. Some people have higher blood pressure in the doctor's office due to anxiety, a phenomenon called white coat hypertension. Others have normal blood pressure in the office but high blood pressure at home, called masked hypertension. Home monitoring over several days or weeks gives a more accurate picture of your typical blood pressure. This is why doctors often ask patients to do home monitoring if office readings are borderline or concerning. The 10th major mistake is not understanding the relationship between blood pressure targets and age. For adults over 65, a slightly higher blood pressure might be acceptable and even preferable in some cases. Some research suggests that very low blood pressure in very elderly people is associated with worse outcomes, possibly because low blood pressure reduces blood flow to the brain and other vital organs. This is particularly true for people who have already had a heart attack or stroke. The relationship between blood pressure and outcomes changes with age, and this should be considered when setting blood pressure targets. The 11th major mistake is not discussing individual risk factors with your doctor. Your cardiovascular risk is not just about blood pressure. It includes your age, your cholesterol levels, your smoking status, your diabetes status, your family history, your weight, and other factors. Some people with blood pressure of 140 have low cardiovascular risk due to other favorable factors. Others with blood pressure of 120 have high cardiovascular risk due to other factors like smoking or diabetes. Your blood pressure target should reflect your overall risk. The 12th major mistake is not understanding the difference between treatment goals for prevention versus treatment goals for management of existing disease. If you've never had a heart attack or stroke, you're in the primary prevention category. If you've already had a heart attack or stroke, you're in the secondary prevention category. Blood pressure targets might be different in these situations. Now let me discuss what you should actually do about your blood pressure. First, know your numbers. Find out what your actual systolic and diastolic pressures are right now. Get them measured properly by a healthcare provider or with a validated home blood pressure monitor. Don't rely solely on pharmacy machines unless you know they're calibrated properly and used correctly. Second, understand your cardiovascular risk. Are you at high risk for heart disease or stroke? Do you have other risk factors like diabetes, high cholesterol, smoking history, obesity, or a family history of cardiovascular disease? Your cardiovascular risk helps determine what your blood pressure target should be. Third, discuss blood pressure targets with your doctor specifically. Ask your doctor what your personal target should be. Ask why that target is appropriate for you specifically. Ask about the benefits and risks of treatment. Understand that aggressive blood pressure lowering might not be appropriate for you, and that's okay. Fourth, if lifestyle modifications can control your blood pressure, try that first. Weight loss. If you're overweight, regular exercise, reduced sodium intake, limiting alcohol, managing stress, and improving sleep can significantly lower blood pressure for many people. For some people, lifestyle modifications alone are sufficient. For others, medications are needed in addition to lifestyle changes. Fifth, if medications are recommended, take them as prescribed. Don't skip doses or stop taking them without talking to your doctor. If you experience side effects, talk to your doctor about adjusting doses or switching medications. There are many different blood pressure medications available, and usually one can be found that works well for you with tolerable side effects. Sixth, monitor your blood pressure regularly. If you're on blood pressure medications, monitoring helps you know if your medications are working effectively. If you're not on medications, monitoring helps you track trends and identify patterns. Seventh, address other cardiovascular risk factors simultaneously. Control your cholesterol, manage your blood sugar if you have diabetes, maintain a healthy weight, exercise regularly, eat a heart-healthy diet rich in vegetables, fruits, and whole grains, manage stress effectively, and don't smoke. I want to emphasize something important. If you've been told to aim for 120/80 and you're over 60, ask your doctor if that's still the right target for you. Medical guidelines have changed significantly, and your doctor might recommend a different target. A blood pressure of 130/140 might be perfectly acceptable for you depending on your age and situation. Don't feel like you've failed if your blood pressure is 135. Ask your doctor about your specific situation and what's appropriate for you. It's also important to understand that blood pressure management is ongoing and dynamic. You might need to adjust your approach periodically. Blood pressure that's well controlled for years might gradually increase, requiring medication adjustments. Medications that worked well might gradually become less effective. Your health situation might change, affecting your blood pressure targets. Regular follow-up with your doctor is important. Additionally, be aware of factors that can temporarily increase blood pressure. A full bladder, pain, anxiety, caffeine, nicotine, exercise, cold exposure, and certain medications can all temporarily raise blood pressure. If your reading is high, don't panic immediately. Take another reading in a few minutes in a calm state. Consider whether you had any of these factors affecting your reading. Finally, recognize that blood pressure is just one aspect of your health. Your overall lifestyle, diet, exercise, stress management, sleep, social connections, and mental health all matter for your longevity and quality of life. Focus on these broader health factors in addition to managing your blood pressure. The information in this video is educational and based on current medical guidelines and research. However, everyone's situation is individual. Your personal blood pressure target should be determined by you and your doctor together based on your specific health situation, age, risk factors, and preferences. Don't assume that a particular blood pressure target is right for you without discussing it with your doctor. Your doctor knows your complete medical history and can provide personalized recommendations based on your unique situation. If you found this information helpful and clarifying, please subscribe to Dr. Welling Insights. Subscribing helps us reach more people with accurate health information. Share this video with family members and friends who are seniors or who are concerned about blood pressure. Many people have misconceptions about blood pressure targets, and your sharing could help them understand their health better. Leave a comment below if you have questions about blood pressure, or if you'd like us to discuss other cardiovascular health topics in future videos. Your feedback helps us create content that addresses health topics important to you and your loved ones. Thank you for watching Dr. Welling Insights, and I hope this information helps you understand your blood pressure correctly, manage it appropriately for your individual situation, prevent unnecessary treatment, and maintain your cardiovascular health and independence as you age.